So this is the medial view of the leg, the inner thigh we're looking at here. The first thing that you might notice is this very long muscle here. This is the gracilis muscle. This is the adductor longus, Underneath the gracilis muscle, we have a large muscle. We see some of it here and some of it here. This is the Adductor Magnus, This is the Sartorius muscle. Sartorius muscle. This allows us to cross our legs or kick a soccer ball or a hacky sack with the inside of our foot. Okay, this is the Sartorius muscle. Now, when we look at the anterior portion of the leg, we can clearly see 3 of the 4 quadriceps muscles. Okay, so here's that Sartorius again. Here's that adductor longus. This is the Rectus Femoris. This is the quadricep muscle that sits straight in front of the thigh, of the femoral region. Okay, Rectus Femoris. And the other names are a little bit easy to remember because this is the medial side. I can tell it's the medial side because it goes down over here and it's further up over here. Okay, so this is medial and it's a big muscle. So we call this muscle of the quadriceps the vastus medialis. On the lateral side, we call this the vastus lateralis. The 4th muscle, I can't ask you about it because you'd have to take it apart, and I don't want you to take it apart. But if you're wondering where the 4th quadricep muscle is, there it is. This is the vastus intermedius. All right, so the quadriceps muscles that I can ask you for the practical exam is the rectus femoris, vastus lateralis, or vastus medialis. But this is also the vastus lateralis. Okay, so it's on both sides of this huge tendon here. This huge tendon is the tendon of the tensor fasciae latae. And it's got this big long tendon. So underneath here is where you have the vastus lateralis. Let's look at start looking at the posterior view here and the muscles that you need to know for that. This portion here, this is the gluteus maximus. The gluteus medius sits a little bit more laterally. Okay, the gluteus medius. The gluteus minimus is only viewable if I take this off. So I'm not going to ask you about it. So you don't have to take these apart. So remember, this one is the tensor fasciae latae. This is the vastus lateralis. And then here in the back of the leg is where we have our hamstring muscles. Okay. So this one looks a little bit different because it's got a muscle hiding. The one that doesn't have anything weird to it, and this one sits more laterally. This is biceps femoris. It's one of the hamstring muscles. Okay. Underneath here, here's part of it, and that's part of it as well. Okay. So right here, this is the semimembranosus. And you have to remember semimembranosus that it tends to lie under the semitendinosus. All right. So the hamstrings are the biceps femoris, semimembranosus, a little bit up here too, and the semitendinosus. Semitendinosus. All right, and coming full circle, here we've got the adductor magnus again. The adductor magnus, which is all of this. The Gracilis muscle. The adductor longus. Remember, this is the Sartorius, the Vastus medialis, Rectus Femoris, and the Vastus lateralis. There's just a few muscles that you need to know on the lower part of the leg here. These both are the gastrocnemius muscles. Gastrocnemius muscles. Their name actually means belly, because they kind of look like a belly, I guess. So these are the gastrocnemius muscles. All right. And here's their long tendon, which is the Achilles, hot spot for injuries. Now, underneath, if I were to take this off, I could see more of it, but everything will be intact for your practical exam. So this portion here is the soleus muscle. The soleus muscle. The soleus muscle lies deep to the gastrocnemius muscles. And I can also see a little bit of the soleus muscle here. It lies underneath the gastrocnemius muscles. This muscle here is the fibularis longus. It lies over the fibula. Fibularis longus. What you're seeing here is the tibia. This is why our shins feel so bony, because there's not even any muscle, it's just bone right here. Okay. So this muscle here is called the tibialis anterior. The tibialis anterior.